Next to this topic, cath lab workers are at most experienced of highest amount of radiation exposure. What radiations are and how they are treated, and how we protect. I would like to call Dr. Abdul Salam to share his knowledge with us.
Assalamu alaikum, everybody. I am Dr. Abdul Salam from Tabba Heart Institute, and I will be talking today about radiation in the cath lab. I'll be focusing on the monitoring and protection. I hope the timer is off. Can we switch the timer off? I don't want the same thing to happen. Okay. This is just a humble request. All right. So the best thing to start with is always the name of Allah. So Bismillah ar-Rahman ar-Rahim. Radiation in the cath lab, what radiation is doing in the cath lab? So cath lab without radiation is not a cath lab. Very simple. So if there is no radiation in the cath lab, then you guys might be jobless. You have to look for something else to do. So unfortunately, I would say it, unfortunately, till now we have no choice but to work with radiation. It's our enemy, but kind of like, it's helping us to treat the patient. So we have to maintain some balance between its like, bad and good effects both. So radiation in the cath lab, it's the basic of basics. I'm sure that you guys have discussed a lot of things which are basics in the cath lab, but I would say it's the basics of the basics because again, no radiation, no procedure is going to be done. So all the coronary angiographies, angioplasties, peripheral procedure, electrophysiology procedures, and etc. are being done always under radiation. Without it, we cannot do that. So cath lab is radiation. So everyone, I think, over here is working in the cath lab, and you all are familiar with these things over here. So this is, a machine which has a C shape. It's called a C arm or C arc. It has two ends. One is under the table, and one is above the table. And I know majority of the people, when they come for the first time, they think that, the radiation is coming from up, because this is the thing where they see, moving here and there. But actually, your enemy is hidden under the table. So remember, always you see, something coming from there. If I was the one who made this, I would like, put the flame of fire. So there is fire invisible coming from under the table. It's like, radiating the whole patient and the people around as well. So the source of radiation, the X-ray tube or the generator is placed under the table over there in that end. And above the table, as we see, there is another end, which is the image intensifier. It's going to receive all the radiation coming through the body of the patient, which you have over here, and it would translate that on the monitor, and we see all the organs moving in front of us. So this is the source of radiation over here. So this is small thing which is not visible under the table is the main issue, but without it we cannot work. So the question radiation is coming to the patient. So how the cath lab staff, doctors, nursing staff, and technologists are being affected? So it's the scatter radiation, because they have seen that these X-ray beams, when they come from down to up, they touch the patient, the table, and a lot of other things, and they get diverted. So they get scattered. So these scattered beams are actually which is hazardous for us, and it will affect the whole staff around the patients. So so if you see over here, actually, for you as a cath lab staff is the patient who is radiating you. You are radiating the patient to help him out, but actually he is giving you scattered radiation, and on the other hand, he is radiating you as well. So you need to be careful. So keep a distance and keep, always a shielding between. So from here, the idea of shielding has come. You have to keep a barrier between you and the patient which you are trying to treat and help. So modalities of the X-ray, everyone knows about the fluoroscopy and cine acquisition. What is the main difference between them? Fluoroscopy is a real-time, basically, imaging. So while you are doing the thing, it's showing you what's happening inside the body of your patient, but it needs less dose of radiation. So a little bit of radiation can, give you the whole image, and that is the fluoroscopy. When we come to the cine, so it's an image which is obtained at the higher dose of the X-ray, and it is going to be recorded and it's going to be reviewed later. So it's very much important for the clinical decision making. So fluoroscopy is whatever you are doing is under fluoroscopy, but what you need actually, to save and record to be reviewed later, and on which you are going to make your clinical judgment and decision is going to be with cine. But the main difference is actually for one frame of cine acquisition, you need actually around 15 seconds of fluoroscopy. Not you need exactly, actually it's equivalent. So just to make it easy and simple and just for the saving of the time, I would say that 1 second of a fluoroscopy, sorry, 1 second of cine is going to be equal to 10 to 15 seconds of fluoroscopy, right? So you need to be very much careful. So try to avoid cine as much as you can. So yeah, so just to wake everyone up, is radiation safe? Of course, it's not safe at all. So why it's dangerous? It cannot be seen, it cannot be felt, it cannot be smelled, it has no taste, but it's very much harmful. Because we human beings are usually scared of everything which is painful. So this is cause actually no pain, so we are fine with it, but we don't know what is going to happen later. So don't be like this human being, so X-ray and radiation coming from everywhere, but he's so happy with biggest smile, saying that he's feeling nothing. So what is the radiation hazard? We start from the biological effect. So there are two types of biological effect. One, it's deterministic. Deterministic means it can be determined. If you have a particular dose of X-ray, you know that if you go beyond that, you are going to create damage. Unless that is going to be kind of safe or safer. Again, there is no safe dose for X-ray, but it's kind of safer. So you can determine, especially for the skin. So you know if you expose the skin for a particular amount of radiation, something is going to happen. Less that, nothing is going to happen. I'll show you that later. The other one is the stochastic. Stochastic is actually, it's a probability. It might happen or not. For example, cancer. So you must have heard about, like, senior interventional cardiologists have been working in the cath lab for the last 20, 25 years, but by the grace of Allah, they had no cancer. So it's not necessary. It might happen with people after a few years, and it might not happen even after many, many years. This is not moving now. I said to freeze the time, not the presentation. Okay, so as I have mentioned earlier, so the skin effect can be simple desquamation. With higher dose, actually you can cause this ulcer, and as we said, the cancer can happen with any dose, and actually no one knows, because there are other factors associated with that apart from the dose of radiation. So again, so there are two different people are being radiated in the cath lab. One is the patient, and the other is the cath lab staff. But remember that the patient might come to the cath lab only once in his lifetime. But the issue for us, we are going to spend the rest of our life in the same place. So there are particular indicator actually internationally has been set to basically measure the amount of radiation patient and the operators are receiving. So regarding the patient, you must have heard about the fluoroscopy time, about the air karma or the air karma and the dose area products and the peak skin dose. So I'll not go through the definitions, you can see that later, but the machine which you are dealing with, they are smart enough, you don't need to do calculation, they are going to give you all these things during at the end of the procedure. So if you want to see the fluoroscopy time is going to be there, if you want to see the dose area product is going to see that, if you want to see the air karma is going to be there as well, and the new machine also are going to show you the skin of the patient which has been radiated, they'll show you different areas, and they'll show you which area of the skin has got the maximum amount of the radiation. From this, actually, you can expect that this patient might have some issue at this part of his body because we have radiated that more. So it's better, to be familiar with these things, like, in your machine, so you can save yourself and your patient. So fluoroscopy time, it's only the time of the fluoro, but it doesn't tell you about the amount of radiation. So that's why they have decided that it's not a good indicator for the dose of radiation. So when we come to the karma is the kinetic energy released in matter. So amount of energy has come from the X-ray tube. And once it comes to air karma, so it is the karma which has been released from the tube in the air. So anything came from the tube in the air before reaching the patient, it's going to tell you how much it is. But air karma is going to be divided between the patient and between the wall and between you as well. Okay? So it's only the amount of radiation. So you want to know how much the skin of your patient actually has received, then you go to the air karma at the interventional reference point. So this is going to tell you, like, this part of the patient, especially for the skin, how much radiation it has got. Dose area product is something similar. It has been calculated by the machine, area of the body, how much amount of radiation it has got, but actually it determines the possibility of having cancer in the future. And when it comes to the peak skin dose, I have mentioned that already. At the end of the procedure, it tells you which part of the skin of your patient has been radiated more than anyone else. So just look at this. So this is what happened to the skin of this patient 1 month, not immediately, 1 month after receiving 11 gray of X-ray during a procedure. And this bad lesion actually has happened 6 months later after receiving 18 gray. So that's why I said it's deterministic. You know, if you give this amount of radiation, this much is going to happen to the skin. So you need to be careful. So how we monitor that for the operator? That was all about the patient. But we are working in the cath lab. We are getting radiation. So how do we monitor that? So this is where the dosimeter comes in between. Dosimeter is a badge, is a machine. Basically, ideally, everyone in the cath lab is supposed to have that. I hope you all are having that in your cath lab. And if you don't have it, it's your right to request your management to provide you that. So it's going to monitor how much radiation you are getting. So one is optical stimulated, which we call it the OSL, and the other one is the TLD. And OSL, I think, is more common in Pakistan over here. So everyone is supposed to have his personal one. You cannot use your friend's one or your colleague. You cannot give yours to someone else. It has to be only for you, and it has to be all the time for accurate measurement. So how to use the dosimeter? If you have only one, and all of us actually, we have only one, so the recommendation, you have it at the collar side of your body, maybe on the thyroid collar or at the upper portion of your apron. But the international recommendation says that ideally you are supposed to have two. One is going to be outside, and the other one is going to be under the lead garments. The outside one is supposed to be somewhere at the collar level, and the other one is supposed to be under the apron, maybe at the waist level. And they're supposed to be there all the time, I have mentioned already, and supposed to be used by one person only. So the outside one is telling you how much radiation you are getting, and the one which is inside is telling you how much protective is the apron which you are using is there. So it's telling you, like, you know, how much you are protected or not. So individuals, I mean everyone working in the cath lab should, but the institution must maintain a lifelong radiation exposure record. So if you have been working for the last 3 years over there, ideally they should tell you how much radiation actually you have been getting over the last three years, considering that you are using your badge in the appropriate way. So for example, that's what we have here in Tabba Heart Institute. I have removed the name, but you know, on 3 monthly basis, it goes for interrogation, and we come back with the score, and we see who has scored high, and unfortunately, I am one of those who score high, which is not something to be proud of. So about radiation safety. So radiation safety doesn't mean that it's safe. It means that we are supposed to keep ourselves safe from that. So how much radiation is safe? Any dose of radiation is not safe. So we have to radiate our patient as low as reasonably achievable. LARA. So remember, LARA is our motto. It's supposed to be mentioned everywhere in the cath lab. You have to maintain a balance between the result of your angiography and the amount of radiation. You don't want to give less radiation, and at the end of the day, you are having very poor quality angiography. If you see it later, you cannot make any diagnosis. We have multiple times patient got an angiography from somewhere else. They have maybe tried, you know, to compromise on the radiation, but we see the angiography, basically, we don't know where the lesion is. So we end up, you know, doing another angiography. So you are costing the patient more money and more radiation. And also, it has to be slightly higher, but not as high as, like, you know, creating a bad effect for that. So as low as reasonably achievable. So there should be a safety program in every cath lab, including the personnel, everyone in the cath lab, including the director. Monitoring is supposed to be there by the badge, the OSL, and all shielding is supposed to be there, and imaging equipment is supposed to be maintained on regular basis. Training and education, and today's session is one of the training and the education example for that. So how can we minimize radiation in the cath lab? I'll just take you through this very quickly. 2 things you are supposed to reduce, which are the dose and the time, and 2 things you are supposed to increase, which are the distance and the shielding. So you need to have less dose and less time, more distance and more shielding, and this way you are going to achieve less radiation. So the optimal place, again, like, you know, for every technologist, staff dealing with the machine and dealing with the table, keep your table as high as possible from the X-ray tube, and keep your image intensifier as low as possible, almost touching the patient. avoid angulation. Just look at this. This is a very good description. If you are in the AB view, you are getting the least amount of radiation, and the more you increase your angulation, the X-ray amount, because the machine is very smart. The intensifier, if the intensifier is getting less amount of radiation and cannot make a good picture, is going to give a negative feedback to the tube to create more X-ray to get a better image. That's why with angulation, basically, you need more radiation to cross-hold the body tissues and all. So try to avoid angulation as much as you can. Decrease the frame rate. So if you can do a good angiography with 7.5 frames, then don't go for 15, because with this you are reducing the radiation by 50% of that one. X-ray fluoroscopy when appropriate, high quality image not required, then just save the fluoro. Not every machine have this quality, but the new machines, only fluoroscopy, you can just press one button and it's going to be saved. You can use that for the future clinical review and decision making, so you don't need a cine. Collimation is very, very much important, and you need to train yourself to use it. Just focus on the area where you are going to work. You don't need to expose the rest of the body for radiation. Reduce the time. We have discussed that, fluoroscopy and all. And for the operator, don't be heavy-footed. Don't put your foot on the pedal until and unless you are doing something over there. If you are talking to your colleague, if you are adjusting something in your hand, if you are talking to your staff, your foot should be not on the pedal. It should be like always in the air. So keep your foot away from the pedals as much as you can. And the other thing, increase the distance as much as you can. And if you see decreasing the distance doesn't mean that you are supposed to stay 1 kilometer away from your patient. Just see, this is on the basis of the study, decreasing one step, increasing one step away from the patient is decreasing the dose from 100 to 25, and if you make it only 4 steps, is going to decrease it to 6. From 100 unit of radiation to 6 is a huge difference, and that just by taking 4 steps, which is possible. If you are doing an angioplasty, I'm talking about the operator, you have a lot of tubes, 30 centimeter and 20. You can, extend your instrument, and keep it at the foot side of the patient after, fixing your guide over there. You don't need to stick to the head side of your patient, so it's possible. Shielding, use them as much as you can. So all these are available attached to the machine, but majority of the people don't use that. There is this flip over here. I have seen different places, no one using that. So you need to flip it up. You need to bring, the hanging down, to the level of you, and to keep a distance between you and the patient. Shielding, and I'll focus more on the apron because I'm sure every cath lab is supposed to have that. Otherwise, there are varieties of other lead things, which can make you actually an armor from up to down and cover you completely. But 2 things, the apron and the thyroid collar, try not to go inside your procedure until you are wearing these both. And please take care of them. This thing which I have seen, this thing does happen. So please make sure it does not otherwise, because this is actually metallic thing. It can get cracked and it get damaged, then later it's not going to protect you. So this is the right way, to keep them. Maintaining that is very much important. And the cath lab management are supposed to keep check up on these lead materials and make sure that they are in a good shape. Don't take this message to your home, take it with you to the cath lab. I need 1 minute more. So if whatever I said was not very much clear, please just focus on this one. So radiation is harmful at any dose. And radiation assist procedure need to be strongly justified. You need to think 1 million times why I am bringing the patient to the cath lab. Can I avoid that? Can I treat him with medication? So again, not for the nursing staff, maybe for the decision maker, but it has to be justified. Follow a LARA as low as reasonably achievable. Minimize use of cine, use more fluoro, minimize use of steep angles. Just decrease your angles as much as you can. Minimize frame rate. Work with 7.5, not 10 or 15. Keep the image intensifier close to the patient, and keep the table as high as comfortable to the operator from the patient. Utilize collimation as much as you can. Store fluoro if you have that facility. Do not be heavy-footed, especially for the operator. Maximize the distance from the X-ray source and from the patient. Use and maintain appropriate protective garments. Keep the hanging and the other thing with the shield, in their appropriate place. Dose emitter is supposed to be used. This is must. and it has to be used in the appropriate way. I mean, as all the time and only for you. And we need to start thinking about alternative for how long we are going to work with the X-ray only. We need to find something else. So if the MRI is available, if the Doppler ultrasound is visible, if we can develop that, maybe we can just get rid of these X-rays and go for something better. So in your photographic memory, just remember two things: decrease the intensity and decrease the time, increase the distance and increase the shielding. So radiation is your enemy in the cath lab, so meet your enemy always fully equipped with full preparation. Previously, people used to go and fight and they used to wear this one. No matter how strong he is going to wear something to protect him. And you all are heroes when you go and fight with radiation, wear something like this. And thank you very much for that.
Thank you so much, Dr. Abdul Salam, for potential presentation you've given us. And at the last, I would like to call Dr. Mohammad Yasir for Principal of Fluoroscopic Imaging and Cineangiography.